Hello, and thank you for your interest in the University of Missouri School of Medicine Psychiatry Residency Training Program located in Columbia, Missouri. I'm the Psychiatry Residency Program Director, Dr. Kimberly Brandt. Our program is a 4-year accredited program in general psychiatry, and residents have the option to apply to integrate one of those years into their child and adolescent psychiatry fellowship. Every program has its strengths, and we think that our top 3 strengths are a balanced program with multiple practice settings, transparent resident-first leadership, and resident cohesion and community amenities. Psychotherapy and biological aspects of psychiatry are both emphasized from early on in training. You'll receive clinical training on inpatient, outpatient, emergency, consultation liaison, addictions, geriatrics, and child and adolescent services, as well as a variety of specialized and elective settings. These include University Hospital, Missouri Psychiatric Center, Harry S. Truman VA Hospital, Fulton State Hospital, University of Missouri Outpatient Psychiatry Clinic, and a variety of community psychiatry practices.
Hi, I'm Derek Sue, and I'm one of the chief residents. The department is committed to a quality environment in which our residents can flourish. Residents and attending physicians have continuous one-on-one conversations. The program director meets monthly with the residents in an open session to discuss training and residency needs. The resident leadership team is elected each year by residents and attendings. This year, the team includes 2 chief residents, an education chief, a wellness chief, and a director of didactics. Here are some of the changes we've made this year with the goal of making things easier for our residents. We've created a new call sign-up scheduling system, shortening the time needed to sign up for call from 2 hours to 1 hour. We worked with our internal medicine colleagues to update our residents' schedules on their service to mirror those of their residents, so the maximum continuous inpatient rotation length had been shortened from 6 weeks to 3 weeks. And we worked with our neurology colleagues to update our residents' schedules on their service to prioritize general neurology over stroke, as we believe general neurology is more educational for our careers.
Hi everyone, my name is Anjana Dominic and I am current co-chief resident along with Dr. Derek Sue and current PGY3. With 10 residents per class, our department is small enough to allow all of us to socialize with each other, both at work and outside of work, while being big enough to limit each resident's call duties and give us generous amounts of personal time. In the era of COVID-19, we've still been able to safely enjoy outdoor activities together, like group bike rides, birthday parties, baby showers, and mini golf. Whenever COVID-19 is finally over, we hope to get back to things like our didactics, which is our monthly potlucks before Wednesday didactic sessions, and group workouts like yoga and martial arts, and best of all, pool parties.
Because of the diverse interests of our faculty and the many areas of strength within the department, we are interested in and attract residents with a wide variety of backgrounds and interests. Our goal is to nurture specific interests of each resident and help them reach their ultimate goals and potential in whatever way possible. Whether it be research, clinical subspecialty, education, or other interests, we strive to make these dreams a reality for our residents.
In the first half of residency, our trainees gain expertise in inpatient psychiatry. Clinical rotations in the first year include inpatient psychiatry, internal medicine, outpatient pediatrics, child psychiatry, geriatric psychiatry, addiction psychiatry, and consultation liaison psychiatry. Off-service rotations include 3 months of internal medicine and 1 month of outpatient pediatrics, which includes time at our hospital's Thompson Center for Autism and Neurodevelopmental Disorders. Clinical rotations in the second year include inpatient psychiatry, child psychiatry, consultation liaison psychiatry, forensic psychiatry, neurology, and emergency psychiatry. Additional rotations in addiction, geriatric, and forensic psychiatry may be assigned. Off-service rotations include 2 months of neurology, including inpatient and outpatient general neurology, and inpatient and outpatient stroke. The second half of residency focuses on outpatient psychiatry and any desired electives. Most residents complete their 12-month outpatient year during their 3rd year. Outpatient experiences include university psychiatry, VA outpatient, and community psychiatry placements. A weekly psychotherapy-specific clinic is also included. Residents in their 4th year complete remaining requirements for program completion and also complete elective experiences. Some residents choose to transfer into a child and adolescent psychiatry fellowship in their 4th year. Here's a bird's eye view of the major facilities we rotate at. This includes the main University Hospital, VA Hospital, Compass Health Network, Missouri Psychiatric Center, and Fulton State Hospital. On the right side of the map, you can see Fulton State Hospital, which is 20 to 30 minutes away from town. You'll be rotating there for up to 3 months during your first 2 years. Other than that, you won't be assigned there. On the left side of the map, Compass Health is about 10 minutes away from downtown, as is South Providence Medical Building. So let's start off by focusing in on our main hospitals. In the words of steely-gazed forensic investigators in TV shows everywhere, enhance! Using our state-of-the-art image enhancement technology, we're pleased to show you this detailed map of our main hospitals, including the main University Hospital, VA Hospital, and Missouri Psychiatric Center. Most residents park in Parking Structure 7 or at Tiger Avenue Parking Structure, both across the street from these hospitals. University Hospital and Missouri Psychiatric Center are in the same building, which is connected by means of underground tunnel to the VA. So when you're on call and you're summoned from Missouri Psychiatric Center to the VA, and the weather isn't making a walk in the great outdoors so appealing, you can walk there indoors in a few minutes. This is University Hospital. To enter from Tiger Avenue Parking Structure, you would go to the basement level in that same parking structure and use the tunnel to go through entrance screening and enter directly into Missouri Psychiatric Center. To enter from Parking Structure 7, you'd walk to the corner, across the street, and then through the front entrance to University Hospital. Currently, the front entrance is closed so that everyone goes through entrance screening through the patient and visitor parking garage. So, you would instead go to that entrance, skip to the front of the line due to your employee status, and then pass Lakota Coffee on your way to the lobby, shown here. It takes about 1 minute and 40 seconds to walk from Parking Structure 7 to the main lobby. Walking towards Missouri Psychiatric Center, you'd pass the hallway to the Physician's Lounge, which is open 24/7. As a resident, all food and drink in the lounge is free. Because of COVID-19 precautions, only pre-wrapped or packaged food is currently being offered. This includes frozen foods like mac and cheese, Hot Pockets and lean cuisine, hot food like donuts, soup, and instant oatmeal, pre-made sandwiches, and snacks like chips, granola bars, and fruit. In normal times, you would have a rotating breakfast and lunch bar, which would include things like biscuits and gravy, Caesar salad, and cinnamon rolls. Not pictured here are a separate open seating area and a computer room. Moving on from the Physician's Lounge, you would walk to the Assessment Unit, which is our psychiatric ED and is physically connected to the non-psychiatric ED. Our resident workroom is 17 feet by 20 feet and includes 4 desktop computers. Our hospital EMR is Cerner PowerChart. You'll be spending a lot of time in the assessment unit, as this is your main base for the consult liaison rotation, on-call, and on night float. The assessment side of the unit can hold up to 10 patients, and the observation side of the unit holds up to 11 patients. Going up one floor, we get to 2 North and 2 South, which are the adult inpatient units. 2 North maximum capacity is 21 patients, and 2 South maximum capacity is 23 patients. There are multiple locked doors in each hallway, and there are always staff nearby to assist in case of emergency. On the 3rd floor, we have 3 South, which is the inpatient child psychiatry unit. It's split into adolescent and pre-adolescent sides. Maximum capacity is 11 adolescent and 6 pre-adolescent patients. We also have a resident workroom on this floor, measuring 18 feet by 20 feet, and typically it's the main base for both inpatient adult and child rotations. Also, the Psychiatry Resident Lounge and Administration offices are on this floor, including the conference room, which was used for didactics in the pre-COVID-19 era. Going down to the basement level, we can head through the tunnel over to the VA before going up 2 levels to 2B and 2C. 2B is the locked inpatient unit with a maximum capacity of 11 patients, and 2C is the unlocked addiction treatment program unit with a maximum capacity of 14 patients. The resident chart room is 18 feet by 21 feet and has 6 desktop computers. Here are some photos from outside the hospital. Shown first are the entrance directly to Missouri Psychiatric Center and Tiger Avenue parking structure. Although this ground level entrance is closed due to COVID-19, you can still enter through the basement level. Walking east on Hospital Drive, You pass by the patient outdoor recreation area before getting to the VA on your right and to University Hospital on your left. Here are the exteriors of Compass Health and Fulton State Hospital. As these are not located at the main hospital, they aren't typically included in the hospital tour, so we didn't take pictures of the interiors. This is South Providence Medical Building, where we do our university-based outpatient psychiatry and psychotherapy, as well as neuromodulation. This isn't included at the main hospital either, so again, we didn't take pictures of the interior.
Hi, this is Dr. Moed Isman, the Medical Director of Neuromodulation Clinic with Missouri Psychiatry. All our inpatient attendings provide electroconvulsive therapy to our inpatient and outpatient clients. We also provide transcranial magnetic stimulation, cranial electrotherapy stimulation, deep brain stimulation, vagal nerve stimulation, and esketamine to patients who suffer from treatment-refractory mental disorders. As a resident, you will have the chance to get trained on these modalities and gain the knowledge and experience in this field.
Hi everyone, my name is Vera Prisakari and I am a third-year psychiatry resident here at Mizzou. Third year has really been my favorite year of residency so far. Not only do we get to preference our clinic schedule, but we also have a variety of clinics to choose from. One of my favorite clinics has been the Perinatal Psychiatry Clinic offered by Dr. Brandt at South Providence Medical Building. Every Friday afternoon, 3 residents, supervised by Dr. Brandt, each get to see about 3 to 5 patients that are postpartum or peripartum. Our patients are referred to us by OBGYNs or PCPs in the community, especially when they have screened high for postpartum depression or there are concerns for psychosis. The goal of our appointments is to get patients stabilized on medications, refer them to appropriate community resources, and transition care back to the PCP. Our appointments are 1 hour long for new evaluations and 30 minutes for follow-ups. Currently, just like many other psychiatry clinics, we are offering both in-person and telehealth Zoom appointments. It is really a privilege to get to see the improvement in the mental health of a young mom, and especially the young baby that depends on its mom. We really hope to see you in a couple of years in Dr. Brandt's Perinatal Psychiatry Clinic. We'll see you soon.
Hey everybody, my name's Jesse Garwood. I'm a third-year resident. Today I'm working at the Student Health Center Clinic for Psychiatry. The Student Health Center will serve anybody in the undergraduate and graduate program, so typically like 18 to your like mid-20s, but it could be, older folks who are coming in for an advanced degree. Typically, you'll see a lot of the same depression, anxiety that you would see at other clinics. But you get some really interesting cases that come through, like first episode psychosis, first episode like mood disorder type stuff. You can have a lot of personality disorders that come through. There's even some occasional like eating disorders, people who have been in treatment and now they're on maintenance therapy, that kind of thing. It's a pretty interesting and rewarding position, very interesting population, a lot of fun for, an outpatient clinician.
Hello everyone, my name is Henry. I'm one of the third-year residents, and I'm going to be talking a little bit about our Compass Health Clinic site. It is primarily a telehealth site, and so all the patients we see there are seen over video, and so it's a good experience to have, especially with how common telehealth is becoming lately with COVID and everything, and so it's good practice to have. You can see a pretty wide range of people because we're not limited by distance, and so you see a lot of rural patients, a lot of patients who are in residential facilities, and patients who maybe are in drug rehab facilities, and so it's a good experience to have and really rounds out our residency.
We also have a methadone clinic new this year. Unfortunately, it has not started yet. It will be run through Compass Health, and it's envisioned as a telehealth clinic with patients across the state. So further information is to be determined.
Hey everyone, this is David Marr here. I am one of the third-year psychiatry residents over at Mizzou. I'd like to share with you guys a little bit about my experience at the VA clinic in the psychiatry department. I'd say overall that Mizzou Hospital is rather fortunate to be affiliated with one of the VA hospitals, specifically the one here in Columbia. Harry S. Truman VA is what it's called. It's rated as one of the top VA hospitals in the country. But as far as the psychiatry outpatient clinic goes, working with the patient populations there, which obviously consists of veterans, I'd say it's a very unique opportunity to work with rather complex patients, both medically and psychiatrically. And it's quite a fulfilling experience. As the VA puts it, it gives us an opportunity to serve those who serve. And I would say that as far as any outpatient experience goes, the VA is a little different than, let's say, an academic setting in the sense that it gives us actually a lot more independence as far as what residents are generally able to do.
Here are some of the ongoing research projects in our department. We encourage all of our residents to get involved with research, and research didactics are included in each year's didactic schedules. Our residents have presented at many conferences up to and including the American Psychiatric Association conference, and we are happy to offer whatever support residents request to assist with their research activities and goals. We also offer 2 fellowship programs, including child and adolescent psychiatry and forensic psychiatry. The Child and Adolescent Fellowship consists of 3 residents per year and strongly favors residents from within our training program. Although the fellowship is a 2-year program, residents who match into this fellowship skip their 4th year of general adult psychiatry residency and go directly into fellowship. The Forensic Fellowship consists of 1 resident per year and also strongly favors residents from within our training program.
This is our current PGY1 class, and here to tell you all about his own experience is Dr. Alex Zimmer.
Hello everyone, my name is Alex Zimmer and I'm one of our interns in the psychiatry program here at Mizzou. First off, I want to say congratulations and we are really excited for your interest in joining us. I want to share a little bit about myself and why I chose Mizzou. I grew up in Missouri, so the idea of returning to where I consider home was always something that initially drew me here. Then, when visiting, I found everyone to be extremely welcoming and I really got the sense that they cared for and respected each other, which was apparent even as early as our interview dinner. Current residents were willing to reach out and check in and answer any questions I had even leading up to the match process, and I quickly found it hard to picture myself going anywhere other than Mizzou. As a resident, the faculty provides you with ample opportunities to grow in your assessment and decision-making skills, especially while providing support whenever I've needed it. While it hasn't always been easy, I can say that I've genuinely enjoyed my intern year thus far, and I attribute much of that to support of my fellow residents and friends, mentorship from my attendings, and many of the diverse clinical experiences that I've been able to have so far. Some of those being serving the geriatric and addiction populations at our Veterans Hospital, while others serving as the consulting physician in a lot of really acute psychiatric cases. In just a short month, I feel like I've genuinely had some significant growth as a physician, and I'm extremely grateful to be a part of this program, and I really look forward to you being part of the Mizzou family as well. Thank you.
This is our PGY2 class, and here to give you his perspective is Dr. Joshua Foster.
My second year so far has helped me to improve my clinical knowledge and reinforce a lot of the things I learned in my first year. Most of the rotation sites for second year are the same, so I get the chance to see how far I've come over the last year. One of the best opportunities for taking greater responsibility and autonomy is holding the on-call psychiatry pager as a senior while on call. Call shifts during the first year really helped to prepare me for that responsibility. We also have a couple of months where we are assigned to the night shift. During these rotations, we really get to strike out on our own as providers and manage the patients in the psychiatric units, as well as the admissions to the hospital. While our attendings encourage us to be as independent as we can, they are always happy to help when we have a challenging case. During our second year, we also have our 2-month neurology rotation off service, where we are exposed to and manage general neurology as well as the stroke service. A great perk for the second year is getting paid extra for our short call shifts. They're called Internal Resident Supervised Activity, or IRSA. Additionally, both Mizzou and Columbia as a whole are very friendly and welcoming communities, which was important when I was selecting a residency.
Now we have our current PGY3 class, and I will be telling you all about my own personal experience. What sets third year apart from the others is that the primary focus of this year is on clinic, although I still get some inpatient experience while on call. Each day I'm scheduled at a different clinic, including at the VA, at the MU affiliated South Providence Clinic, our Compass Health affiliated clinics, including McCambridge Center, which specializes in women's treatment and addiction, and at our weekly psychotherapy clinic. Residents also have the opportunity to rotate through our Student Health Center and in our Neuromodulation clinic, where they will gain experience with TMS, ECT, and S-ketamine. These have been really valuable experiences and have improved my own knowledge base and my confidence as a psychiatrist. I've thoroughly enjoyed third year so far, and I really look forward to the new experiences it will bring. Here's our PGY4 class. As you can see, they have 6 residents this year. That's because the other 4 have joined fellowship programs, both at MU and elsewhere, and skipped their 4th year of residency. Here to give you her perspective is Dr. Akriti Sinha.
I think academically, the Psychiatry Division of University of Missouri is quite strong. As an academic chief for this year, I have the responsibility to design the didactic curriculum for our residents. We hold our didactics every Wednesday, 12 p.m. onwards. That normally starts with grand rounds that tries to cover various topics, whether based on innovative clinical models of practice or groundbreaking research or specific topics on diversity inclusion. After grand rounds, we normally try to cover various topics in psychiatry. For our junior residents, we obviously tend to focus on essentials. We try to build a strong foundation for them via PBLs, case conferences, journal clubs, psychopharmacology lectures, a lot of process groups that also happens, as well as basics of psychotherapy. And for our senior residents, we tend to focus on advanced topics, both in psychopharmacology and psychotherapy and clinical care. So they're ready to face the real world once they graduate, or if they were to pursue fellowship. We do tend to, after graduation, we tend to practice all across the country. And some of our residents do stay back as well because they love Columbia and they have kind of built up a great community around them. So overall, our program not only focuses on bread and butter of psychiatry via inpatient in various settings, whether it's the VA or the university, as well as longitudinal outpatient care in the university setting, as well as in the community or via telepsychiatry. But we also focus on various subspecialties of psychiatry, whether it's geriatric population, veteran population, student health, women's mental health, neuromodulation techniques, CNL, emergency, forensics. So we do, once we graduate, are ready to pretty much take any role as a psychiatrist.
And last but certainly not least, we have our PGY5 class. Dr. Ryan Cavalier did his child and adolescent fellowship a year early. So after finishing his PGY2 year, he did 2 years of fellowship and then returned to do his PGY3 year as a PGY5. Here's his perspective.
Hi, I'm Ryan Cavalier, and I chose MU Psychiatry because I had rotated here on some elective rotations as I had gone to a different medical school, and not only were the facilities just amazing, it was more importantly the people that I enjoyed the most, and everyone here made me just feel very welcome, and I could tell that everybody was really driven to not only provide outstanding healthcare, but was really, really driven to provide a good education as well as an experience, and they just seemed to really care about me and my quality of life.
Within the past 5 years, our residents have gone on to fellowship and independent practice both around the country and outside of the U.S. Some of these academic programs include Johns Hopkins, Rush, University of British Columbia, University of Maryland, Yale, Vanderbilt, and UC Davis. Non-academic programs have included places like Burrell Behavioral Health in Arkansas, Compass Health Network here in Columbia, and private practice in Kansas City and Atlanta. Of course, we are so proud to have multiple graduates stay on with us at Mizzou, both in the inpatient and outpatient settings.
Hey guys, I'm Cameron. This is my dog Zephyr. I'm a fourth year resident and this year's wellness chief. So wellness chief is a position that was added a few years ago in response to some residents' request. The role of the position is to really serve as an advocate for both group and individual concerns regarding wellness to our administration, and then as well as plan some activities throughout the year that center around resident wellness. So we actually have a portion of our didactic time that's set aside specifically for these activities, and this can be anything from a social activity or a Q&A with a financial planner. And the administration has been really responsive and receptive to the different ideas and activities that we wanted to plan. For example, 2 years ago, Ansh and I decided that we wanted to really revamp our annual resident retreat here, and Dr. Resnick was really more than willing to work with us on this. We ended up moving the retreat from a Wednesday activity to a full day on Friday, and we tripled the budget. We planned a whole weekend down at Lake of the Ozarks, where we did some barbecuing, boating, and just hanging out, relaxing with each other and with our families, and I think we really had a good time together. To me, it's examples like this that show our program really cares about us, not only as residents, but as people, and it really makes it a great place to work.
Hi everyone, I'm Joel Sager, a second-year resident and current director of Meet Dactics. Meet Dactics is a potluck that we have on the first Wednesday of every month. It was originally founded by one of our recently graduated residents. Although it's named for the delicious meats that we smoke each month, we also make sure we're very inclusive due to the diverse group of residents that we have. We usually have a theme each time, and everyone brings a side dish to complement. It's one of my favorite things about this program, and I'm really happy to carry on the tradition.
Thanks for watching this far into the video. I'll now specifically address how COVID-19 has affected our program and may affect you if you join us. When COVID-19 started, our hospital designated 3 tiers of response. We did reach the highest level, and visitors were temporarily banned from the hospital except for emergency and end-of-life situations. Currently, the hospital has opened up visiting hours daily from 1 p.m. to 4 p.m. with 1 visitor allowed per patient. Boone County, which includes our hospital, implemented a mask requirement which is still in effect. Every person entering the hospital must wear a mask and undergo entrance screening. The hospital also provides blue surgical masks, and we are supposed to use 1 per day, and they can be replaced if necessary. Since September 1st, we also have to use eye protection for all patient encounters, so the hospital has provided face shields and goggles. The main university is adjacent to our hospital, and the university resumed in-person classes this fall. As far as money is concerned, the hospital did lay off some staff and mandated furloughs and temporary pay cuts for executives, attendings, and other staff. However, resident pay has continued unchanged, and we have been told that resident pay is 100% protected and guaranteed. As of September 2020, our service area case rate has increased to about 4.5 per 1,000 population. Our hospital leadership is running virtual town halls on Thursdays at noon, during which they give us updates on the situation and our hospital response, and they answer employee-submitted questions. As far as psychiatry is concerned, our program did move to telepsychiatry as much as possible for 2 months, and since July has moved to a hybrid model. We do not see COVID-positive patients in person. Our inpatient units are also undergoing frequent changes, with the biggest change being the conversion of the assessment unit to an additional inpatient unit. Accordingly, we now see our emergent patients in the main ED. The current hospital policy is to give a COVID test to any patient who is being admitted. The test results, unfortunately, do take a few days to come back, so we have had instances of patients who test positive after having already been on inpatient for a few days. So we are trying to maximize precautions while continuing to meet the needs of our psychiatric population, and we are developing an inpatient unit specifically for COVID-positive psychiatric patients. Again, we will not have to see these patients in person. More changes will undoubtedly be made by the time you interview with us.
Hello, everyone. My name is Sekbaman Alex Sohonyan. I am a psychiatry resident physician at the University of Missouri Hospital, and I am here to talk about the Diversity and Inclusivity Committee of our department. One of the many things we're very proud of at the Department of Psychiatry is how truly diverse we are. However, we know that there is room for growth and improvement, and this is why the Diversity and Inclusivity Committee was created in September of 2019. The purpose of this committee is to make everyone feel truly included, especially the minority population of our department. This is a very active committee. It is led by an attending physician and is representative of various members of the Department of Psychiatry, including other attending physicians, fellows, residents, medical students, administrative staff, therapists, research students, and so many other members of our department. We meet once a month, and since the start of this committee, we've been able to accomplish a lot of wonderful things, including the diversity ground rounds, where we invite outside speakers to come talk about pertinent issues related to diversity and inclusion. We've also been doing something called the Cultural Highlight, which happens once a month, where a member of our department comes to talk about their culture, their practices, and this is mainly to make all of us have more knowledge and aware of what makes us different and what makes us unique in our own individual ways. There's still so much we're working on in this committee, and we look forward to having you as a part of the Department of Psychiatry. Thank you.
That's it for the video. Thanks again for your interest. We look forward to receiving your application. If you have questions, please feel free to contact us through the website or email. Whether you match here with us or at another program, we wish you the best in your career as a psychiatrist.